Module Overview. This module aims to equip you with deep theoretical knowledge and practical competencies in infection control and biosafety within the context of phlebotomy. You will master universal precautions, understand disease transmission pathways, handle biohazardous materials safely, and adhere to strict institutional and international infection prevention protocols in compliance with OSHA, CDC, WHO, and CLSI standards. 8.1 Introduction to Infection Control in Clinical Settings. Infection control in phlebotomy is not optional. It is a legal, ethical, and clinical imperative. Phlebotomists regularly handle blood and other potentially infectious materials, OPIMs, making them vulnerable to bloodborne pathogens like HIV, human immunodeficiency virus, HBV, Hepatitis B Virus, HCV, Hepatitis C Virus, MRSA, Methicillin-resistant Staphylococcus aureus, syphilis, and other STIs. Healthcare workers must break the chain of infection, which includes infectious agent, virus, bacteria, etc., reservoir, blood, patient, equipment, portal of exit, puncture sites, secretions, mode of transmission, needle, gloves, hands, air, portal of entry, open wounds, mucosa, needle sticks, susceptible host, phlebotomist, patient. 8.2 Standard Precautions, Universal Precautions. Developed by the CDC, these apply to all patients, regardless of diagnosis. They include hand hygiene, alcohol-based sanitizer, preferred if hands are not visibly soiled, soap and water after exposure to bodily fluids, gloves removal, or patient contact, wash for at least 20 seconds, personal protective equipment, PPE, gloves, single-use, change between patients, gowns, aprons for splash risk, face shields, goggles, masks for airborne blood splash protection, respiratory hygiene, use tissues, surgical masks on coughing patients, dispose of tissues appropriately, maintain at least 3 feet of distance from coughing patients, safe injection practices, never reuse needles or syringes, use needle safety devices, use single-use vials when possible, safe handling of equipment and environment, disinfect surfaces between patients, use approved biohazard containers, clean spills immediately using appropriate disinfectants. 8.3 SHARP's Safety and Exposure Control Plan. OSHA's bloodborne pathogen standard requires all phlebotomy facilities to have a written exposure control plan, ECP, provide hepatitis B vaccination to employees, ensure annual training and updates, provide post-exposure prophylaxis, PEP, within 2 hours of incident, SHARP's protocol. Do not recap needles unless using one-hand scoop method. Use needle safety devices, retractable, self-sheathing. Dispose of used SHARPs immediately into puncture-proof, labeled SHARPs containers. 8.4 Biosafety, Levels and Hazard Identification. Phlebotomy labs typically fall under Biosafety Level 2, BSL2. Handle pathogens that pose moderate risk, hepatitis, HIV. Access restricted to trained personnel, lab coats, gloves, eye protection required. All procedures with infectious agents done in biosafety cabinets, BSCs, when aerosol generation is possible. Biohazard symbols. Always recognize and respect the universal biohazard symbol, found on SHARP's containers, biohazard bags, refrigerators storing blood specimens, color codes, red bags, infectious waste, yellow bags, clinical waste, blue, black, non-infectious general waste. 8.5 Post-exposure protocol and reporting. In the event of an exposure, flush affected area, wash skin with soap, eyes with water, report immediately to supervisor or designated official, document incident, thoroughly initiate post-exposure prophylaxis, PEP. If indicated, follow-up testing and counseling. Key timelines: PP for HIV, within 1 to 2 hours, hepatitis B vaccination, series must be completed pre-exposure follow-up testing at 6 weeks, 3 months, and 6 months. 8.6 Environmental cleaning and waste disposal. All surfaces, chairs, trays, counters, must be disinfected between patients. Use EPA-approved disinfectants, e.g., bleach solution 110. Dispose of soiled gauze, gloves in biohazard bags. Transport specimens in leak-proof, properly labeled containers. 8.7 Institutional infection control programs. Accredited healthcare facilities must maintain infection surveillance systems, conduct regular audits, have standard operating procedures, SOPs, on PPE usage, hand hygiene, needle disposal, specimen transport, staff immunization. Hospitals must comply with Joint Commission on Accreditation of Healthcare Organizations, JCAHO, Clinical and Laboratory Standards Institute, CLSI, GP05, A3. 8.8 Global Infection Control Initiatives, WHO, CDC, OSHA, Organization. Key contributions: WHO Global Best Practices, Phlebotomy Toolkits, Universal Precautions, CDC Bloodborne Pathogen Guidelines, Standard Precautions, OSHA Legal Enforcements in U.S. Workplaces, Training Mandates, CLSI Technical Standards for Labs, Specimen Handling, Infection Control. Compliance with these authorities ensures patient safety, staff protection, legal adherence, institutional accreditations. Learning outcomes for Module 8. After completing this module, you will be able to identify and explain various bloodborne pathogens and transmission modes, execute standard and transmission-based precautions in phlebotomy, properly use and dispose of PPE and sharps, respond effectively to exposure incidents, comply with OSHA, CDC, WHO, CLSI infection control mandates, participate in institutional biosafety programs and audits, maintain a safe, sterile, and legally compliant work environment,